Hello, it's Time Community. We are so excited to be back with you again. Today, we are all three in the same town, not in the same physical space, but so often Dr. Jen and I and our guests are all over everywhere. But we are so happy to have our local expert on super interesting, cool things for women in midlife also here in Park City with us today. Lindsay Wojciechowski, who is here working with midlife women and actually people of all walks of life, but she's going to talk with us specifically about midlife women and how to think about recovery and how to think about nourishment. And so thank you, Lindsay, for taking time with us today.
Thank you so much. It's an honor to be here.
Yes. Listen, before we dive in, I know there's some specific questions that Dr. Jen and I have, but we'd love for our community just to know a little bit about your origin story. How did you get to the work where you are now? And what's kind of mission critical for you as you're going in this year, especially with a lens of midlife women?
Yeah. Well, thank you so much. Yeah, I don't think I can explain what I'm doing now without talking about where I've been. So, yeah, I can touch on that. I grew up in Salt Lake City, so left Utah about 25 years ago. I moved out to North Carolina to pursue medical training at Duke University. Ended up the way life does. I ended up staying there for about 10, 15 years and ended up in what I thought was my dream job, which was a family practice setting in a Duke outpatient clinic. I remember my first day on the job sitting at my desk with my prescription pad. Like I was so excited.
Yes.
And I loved the job. There was a lot of meeting with it. It was such a wonderful start, but it wasn't long into my career that I realized I was really only trained to diagnose and prescribe. And while that model works for a lot of people, for a lot of my patients who were chronically ill or had symptoms that just didn't make sense, it was falling short for a lot of people that I was caring for. In addition, I felt very limited by I love looking at the root cause. Why is somebody unwell? What's going on? What's caused them to feel this way? And in the conventional system, you're a little bit more limited on the information that you can obtain, right? You can only draw so many labs on a well visit. Otherwise, you need diagnostic codes to justify what you're trying to obtain. So I just felt very limited. And at the same time, started my own personal health journey. I had a cancer diagnosis and felt pretty shortchanged by the guidelines that were provided for me. I really wanted to dive into my terrain. How can I keep myself healthy? How can I nourish myself? How can I detox? How can I optimize my terrain so that this doesn't come back? So started to pursue integrative and functional medicine training before moving to Milwaukee in 2014. Shortly after that, my medical interests were really pushed down a different direction by the way life takes us. My now 18-year-old son at the time was 9 years old, and he was perfectly healthy until one day when we now know he suffered from an autoimmune disorder triggered by strep throat that attacked his brain and caused really acute inflammation. It took about a year to get a good diagnosis, and even then, it became very clear to me very quickly that the conventional system did not have the bandwidth to dig into the root cause of why he was sick and how we were going to get him well. And so I dug into the last 10 years, like a deep dive into gut health, autoimmunity, neuroinflammation, tick-borne diseases, mold toxicity, the very real impact of trauma on chronic health and wellness, and really all things that cause neuroinflammation. And how do we miss any of those pieces? I don't think we would have made my son well. You to say he's graduating from Park City High School in June with his peers. We're back in Utah, and I'm now at a clinic that allows me the bandwidth to really dive deep with patients that are interested. I'm also a 49-year-old perimenopausal, occasionally stressed out female. So my attempt in medicine is also to try to help heal myself, right? So I've taken a really deep dive into hormone and hormone replacement therapy and the very real impact of supporting the nervous system for a lot of us that has a very direct relationship with our hormones.
Wow, that is such a great journey and just robust with the different levers you've had to become an expert on in order to pull them in your own immediate community as well as with your client base.
Yeah, it's a remarkable journey. And, I think that it's so fascinating to me. And I continue to be kind of in awe and in frustration that our conventional medical system continues to be just so behind the times. I also have a graduating senior from Park City High School who had an autoimmune disease actually as a toddler, and a lot of the same things to try to get her better, and it's interesting. It just how much you have to advocate. But I wanted to focus on, I've had actually three conversations today, just today, on this idea of trauma and this idea of longevity and health span. And how I feel like that has kind of been part of the missing component. I think we've gotten pretty dialed on like whether we do it or not, we kind of know how we should be eating. We know we should be sleeping. We know we should be moving. And like those are all critical and very important components. But I think this idea of trauma and diving into what that means for each individual person is so unique and so personal and so important. I'm not even sure in our highly specialized settings we're very good at doing it yet.
Yeah, it's not something that I really appreciated until the last 5, 10 years of my medical training. And it's really just the way life's evolved to show this. If I can think of like a handful of patients that I'm haunted by that I wasn't able to, like, we were never really able to move the needle despite doing everything right. And I've gone now and circled back with those patients. And the common theme behind a lot of those patients is a really high trauma history, right? Whether it was in childhood or the stressors as an adult. I've really learned to have to tune into that with patients, because if I don't appreciate that, I don't know that I have the ability to really to really help support somebody on their journey to complete wealth or health and wellness.
So I love this topic. And I think one of the reasons why I'm so interested in it is I don't understand a framework for it yet. I think there maybe are a lot of women who are like, "Oh, I probably don't have trauma," and they actually do. So it's like, how do you give people a way to think about trauma in their day to day now? Like a lot of people are just navigating it and kind of muting it or squashing it in their now. And then how do they have a framework for how to reflect on their history to give voice and credence to what was actually traumatic?
I would even back up a question further than that. How do you define trauma for people? Is, like in the medical sense, like I could define trauma as one thing that is very different than probably societal trauma. So I would just love for you to start with like, how do you even define trauma? So people, Linz, to your point, kind of understand, because I think a lot of us are like, I haven't had any trauma.
Yeah.
Because we may not even associate that word with those feelings or emotions or circumstances.
Yeah, I mean, I'm certainly no therapist and an expert in this, but I think one of the things I've read a lot about this, and I think trauma is sort of how we experience it. And I've been told that it's a feeling of which we have no control, right? That we're powerless to that experience. And, I don't know if you've read the book, The Body Keeps the Score, but how to bring it up. I think it's a very, very gentle topic. I've started to be a lot more bold asking about it with patients. That's not something I would have jumped to initially, but after I've built a rapport with patients and they trust me, it's something that I feel comfortable bringing up. I brought it up to a patient yesterday who's having a hard time losing weight. I just brought it right up. Like, I think this is something we need to consider and explore as a puzzle piece to you as a whole terrain, right? Not the whole thing. I'm certainly not going to push everything on that, but it's a piece that we should probably start exploring. I brought it up to another patient last week. I've been working with her for about 5 years, and she's had chronic gut issues, and we've done everything. And finally, after a couple of years, we brought up the conversation: is there stress? Is there chronic PTSD? Is there stress? And we started to do some breath work, and her symptoms are about 80% gone. So I think it's a topic that's gentle, and it requires a lot of trust with the practitioner before it's brought up, but it definitely needs to be brought to the table.
I love that invitation of being gentle, because my perception is that when you talk with people about trauma, it's just not a rational reaction, but there might be some shame or some, "If that didn't happen," or "That's not me." And so giving people the invitation and the permission to express that trauma and without responsibility for whatever that set of activity was, that what I like the framing of it, that it's something that leaves you with a feeling of powerlessness. And that could be everything from you're forced to move as a child, you have no control over that. It's traumatic to go into a new school. I mean, I had to do that every year. So maybe that's trauma. Or it could be you have a really verbally abusive boss, and you have to deal with it every day. So I love the idea that it's a situation where you feel powerless and it's causing you stress. That can fall into the camp of trauma.
Yeah. Yeah. And I think, there's trauma and then there's stress too. And one of the biggest things that I see impacting women in midlife is stress. And I don't say that to add stress to stress. I say it to validate it, because if I had $1 for every time somebody sat in my office, and we talk about how to support their cortisol and their adrenal glands and their thyroid and their weight and their sleep and their blood sugar control, like all of that is so negatively impacted by chronic stress. And, I've had some very well-intentioned clinicians tell me during really scary times of my life that I needed to manage my stress better. And that doesn't always come across as like the most supportive feedback. And, so I try to tell women to just be really intentional about what fills your tank. Like there's stuff that does it for me that may not do it for you. But as we get older and wiser and understand ourselves better, I think it's really important to be intentional about what does it for me. So that as I navigate stress, which is going to come, Earth is a hard place to be sometimes, especially nowadays, that I'm being intentional about filling my tank as I can. Because, when we get into women's health and hormones and blood sugar control and all these crazy cool modalities that we have here in clinic, they're only so helpful with a nervous system that really needs a lot of support. And I say a lot of compassion. I've been somebody there as well.
Yeah. I would love to build on the topic of recovery too. I think when we talk about stress, when we talk about trauma, and I think especially for women, I was thinking about this on my run this morning. Like ran on Sunday, awesome run, felt great, felt like I could have gone for hours, felt so good. Today, like absolute slog. And I'm like, I know my fitness in a week hasn't changed very much. I know. And this is obviously a very specific type of recovery, but I think we are so hardwired to just go, go, go and not stop and not allow our bodies, our minds to reset, allow our nervous systems to take a little time out and come back to baseline. What are you seeing in this space and what modalities are you recommending? Especially, we are all kind of in the same phase of life. There's lots, not only is our bodies changing, our environments are changing. We have kids leaving. We have, all of these different moving pieces, aging parents that keep falling down, like all of the issues, right? And so what recovery modalities are you seeing that are really impactful, especially for this nervous system reset, especially for this recovery to help us? And how often do we need to be doing it? Because I know it's the thing that gets least prioritized for me every single day. And it also carries, and I hate to say this, but it's the truth, it carries the most amount of guilt. Like, oh gosh, I don't want, like, what if my neighbor sees me sitting on the couch at like 11 a.m.? Like, what's the impact of that? Like, what if somebody realizes I haven't answered an email by 7 p.m. that night? What's the impact of that? And so, like, I feel like it's the thing that I just get pushed down and kind of feel guilty if I do it.
Yeah, I think we can all relate to that first and foremost. I guess before I'd comment on modalities, and I will, there's a lot of them, but, I've done talks on stress and what we should be doing and what supplements. And I've started to be a lot more tailored, and data collection is much more available to us than it used to be. And so I guess the first thing that I would say is start by advocating to learn your data, like learn your numbers, right? Because then we know how to support. If I check my cortisol curve, my stress support, and I'm sky high because I'm really stressed, there's going to be different measures that I'm going to do for that, as opposed to, during periods of life I've been where I'm probably not making any cortisol because I'm in such adrenal fatigue because I've been going, going, going. One modality would have probably helped me in one and hurt me in the others. And, my markers are going to change based on my stress. My blood sugar is going to change. My inflammatory markers are going to change. My thyroid might start becoming dysfunctional because of stress. So I'd say, and that's not meant to scare anybody. This is where the power is, right? This is where we become empowered to learn our own data so we know where to put our emphasis and our time and our resources. So to answer your question better, I have a tailored program for me that I can see moving the needle and I know exactly what I need to do. So I love to draw labs. I love to look at adrenal curve and see stress response. I love to look at gut health. So I can say to somebody, okay, this is the tailored program that I want for you. We're going to support the adrenals. We're going to pull them back up, or we're going to support the thyroid, or you're a vegan and we need more B vitamins to help you detox. So I'd say number one would be learn what your data tells you. And if you're with a clinician that can't dig into that, find another clinician who's willing to dig deep. It might be a cash pay model because you're asking for your info. But then, in terms of like the umbrella of modalities to support stress, I go back to number one, find what fills your tank, first of all, because if you're doing something that's therapeutic but you hate it, it's probably not going to be very beneficial for you, right? So collectively, what works for your friends might not work for you. But, in terms of integrative and functional tools, there's cranial sacral therapy, there's acupuncture. I've never in my entire life worked somewhere before that had sound healing and sound baths to tap into. They're so great. My 18-year-old son will even do them. There's light therapy, right? Like using photons and light to modulate biology to help with relaxation and detox and calming the nervous system and supporting that. We even have IV CBD here. It's one of my favorite tools. I've used it for myself. It's not psychoactive. There's no THC, but It really targets the endocannabinoid receptors that help balance, right? It's almost like butter on the nervous system is the only way I can describe it. So I use it for people who have PTSD, who have stress, who have fried nervous systems. I use it for people who have neuroinflammation from Lyme disease or mold toxicity. Again, you want to get to the root cause, but it can be really helpful with that. So those are kind of the biggies that I think of for stress support
Mhm.
in
So if you
clinic.
Yeah, if you think about those in clinic, that would be if somebody can find someone like you and go, okay, I want my data. What should they be asking for? Is there a set of panels that would be a starting point where or if they want to be able to tell, are they getting to someone like Lindsay? What questions should they ask?
In terms of labs, I mean, if you feel relatively well, right, you're just looking for data collection. My website that I think we're going to post in the show notes lists, if you go to my testing section, it lists panels that I've put together. I know Mark Hyman and Function Health have things you can buy online and you can get information. It doesn't really come with a clinician to explain it to you. But I've put panels there in terms of like nutrition, inflammatory markers, steroid, blood sugar control, autoimmune response, those kinds of things, the precursors that we need to make hormones. Because when we talk about things that calm us, progesterone is one of our hormones that we lose. It starts to be depleted in our perimenopausal windows, right? So looking to make sure we have the precursors to make them in the first place. And then looking for things that can derail our hormones, right? Do I have diabetes? There's a lot, do I have just chronic inflammation that's going to derail my ability to make progesterone, which is my calming hormone, right? So my website lists a lot of panels I've put together. It doesn't mean that that's what's right for everybody, but it's a lot more than the 5 lab tests that they can draw to conventional systems and insurance-based
Yes.
model.
Yes. And I think the combination of the in-clinic treatments with suggestions that you've had about what can you do at home, like just, on your own before you get in clinic to kind of help you regulate your nervous system and help you manage your stress levels.
I mean, this is silly. I have a list and I call it my delight list and it's taped to my fridge and it's not a gratitude list. It's delight. Like it's what does it for me and no judgment. There's like a few really cheesy 80s songs on there. There's some friends that always fill my tank when I get off the phone with them. Like when I'm stressed, it's easy to lose touch with those things. We get overwhelmed. We lose touch with them. I'm depressed. I lose touch with them. Sometimes literally having it taped to my fridge so that I can see it. I'm like, okay, I'm not in a good space. I know if I've told this really cheesy 80s song and I get in the car with the windows down, that's what does it for me. But I've had people give me all different feedback of what does it for them.
I love that, a delight list. That's gonna for me. I love that.
Same thing, being able to have it be tangible, like you can go back to it versus come up with the answer when you're in that fried state is such a powerful preventative tool that you can access.
I did a podcast years ago about this with a friend of mine, and as a result, I got a lot of people texting me, like starting to think about it and sending me their delight list. I'm like, well, I never would have thought of that stuff, but everybody's got their own unique list, right? So that's why I'm saying being intentional about what does it for you, and sometimes it's just really simple things.
Yeah. Are there any at-home data collection tools that you're seeing out there that, midlife women might want to consider so that they've got a hand on some data at a daily level? Because I do all the function health tests. I go in pretty regularly. I'm pretty much a data hound, as is Dr. Jen. But there are times when you're kind of just in the weekly or daily cycle, and I don't really know as many of those that other than HRV on my Aura ring that might tell me that's at least on the stress curve where I am and how I've been able to impact it other than, again, HRV moving.
Yeah, HRV is one, again, and it's none of these are meant to obsess over specific numbers, right? It's just meant to watch for patterns. Am I moving in the right direction as a trend, not panicking about all of my daily numbers? Some people track their sleep, but again, sometimes it can be a stressor too. If you're like, I didn't sleep, now I'm stressed and it's going to get worse. I'm a huge fan of controlled glucose monitors. So even for people without diabetes or pre-diabetes, especially as we get into perimenopause and menopause, and we know that when our blood sugar is less controlled, which just happens by way of getting older, that's always going to be inflammatory. It's going to impact brain health. It's going to impact hormone production. So learning what makes your sugar go up more quickly. I wore one for several months. It's like a super fun way to like for everybody at the dinner table, like watching your blood sugar trend. But even stress, you can see peaks in blood sugar go up when you're chronically stressed, and just learning your patterns so that you can make the right food choices that work well for you, I think is a good one. That's probably my favorite one.
So I think, other things that like we've touched on, obviously there's a lot of information about hormones now, which is awesome. I'm so excited. I feel like it's what I talk about every day with every person, which is awesome. Like it's just become normalized, right? And hopefully becoming more and more accessible to more and more people as we expand the networks of providers that are comfortable having those conversations. What are you seeing for people who hormones may not be an option for? So when, we're working on hormone regulation, or especially for women transitioning into menopause, who, and even though that list has gotten very, very small, but who hormones may, or they just may not want to have that type of therapy. What are you seeing emerging more as kind of alternative therapy, given the fact that now I feel like the pendulum is so on, like everyone had hormones, no one had hormones. Now we're going back to saying, oh, almost everyone can have hormones, but I feel like there is a comfort lag. I see this all the time with guests that are coming to see us, that they're really excited until you go to write the prescription and then they get really nervous because that 20 years of being told that these are bad for you, that these are going to cause cancer, these are going to do all these horrible things to you. When it comes time to put the patch on the skin or put a pill in your mouth, like those emotions and that fear is hard to get over. And so, what are you seeing as alternatives for people who are just not ready to maybe approach the hormone conversation?
First of all, you guys did an HRT summary a couple of months ago when the black box warning came off. It was so well done. I was like, I wish I had said it exactly that way. So I hope people will go back and reference that podcast. It was so well done. So I couldn't have done it better if I had planned and done it. So hopefully people, if they are still curious, can go back and reference those types of conversations, because education is empowerment, and not to say that education means I now choose hormone replacement therapy. Education may not just mean I feel way more confident in what's right for me, right? And there's a lot of different ways to do hormone replacement therapy. Again, like you said, that window or that category of people who are not good candidates has gotten smaller and smaller and smaller. But if it's not right for people, or if that doesn't feel like the right choice after they feel well educated about their decisions and the scientific facts, not the narrative that we've been stuck with for so long, there's a lot we can do to support the production of our own hormones. And I talk about this a lot in podcasts. Like, number one, we need the precursors required to make hormones in the first place, right? So talked about those with digging into your data and identifying, do you have those in the first place? Vitamin D and optimal thyroid function, great adrenal curve, and stress support. So you need cholesterol, you need all those good things too. And then secondly, again, as we already mentioned, like, are there things derailing your ability to make them in the first place and exacerbate imbalances, stress, diabetes, environmental toxins, etc. And really optimizing the terrain. And then, looking at how you detox your hormones too, making sure the hormones that you are making, you're detoxifying them and excreting them effectively, right? It's not a matter of just taking hormones. It's a matter of building them, using them, detoxifying and excreting them, and doing that optimally. And then there's supplements that can help support the production, probably more effective in our reproductive and perimenopausal years than for somebody who's 65, 70. But there's still options like things like Vitex and Cheese Berry that can help support progesterone and adrenal support products. So I'd kind of go back to the basics.
Yeah, I think it's a tricky one. Right now, I'm having a conversation with a couple of people who are in their 70s who are really curious. Like, I want to start taking hormones because that's really starting to be the cohort who are the most negatively impacted by this narrative. And so, I'm obviously directing them to some of the experts that we've had a chance to have on our podcast. But my overarching thought is it's most likely a great solution for you. It's something you can continue doing until the end of time for you, which it was an eye opener for me. And I think for a lot of women was that there wasn't a shelf life on how long hormones could be helpful to you and your comfort and your energy.
Hmm.
Yeah,
Yeah.
you guys have alluded to it on your podcast before. I was taught the lowest amount for the least amount of time. So
Yeah.
luckily we know more now.
Yeah. And I think in that age group lens, just to double down on that for a second, I think we're learning a lot more about risk assessment too, that, even if you're 70 and never been started on them, it doesn't automatically disqualify you anymore. Like, yes, we need to do probably a deeper dive than if you're 50, but that still doesn't mean that it's an automatic no. It's just a different risk stratification. Maybe need some additional evaluation before starting, really deep dive cardiovascular evaluation, et cetera, just to make sure that all of those things are appropriate and that you understand the different risk profiles. But I think that's amazing. And Lindsay, goes to your point so much about just encouraging this education. And, I think to, again, just be able to provide solid science-backed information, especially for people that may not have access to your clinic or may not have a provider in their area that is savvy or up to date or comfortable. There's comfort lag on both sides, right? There's comfort lag on the patient side that, yes, I'm really interested in this, but I still have some fear. And I think that exists on the practitioner side as well.
Yeah, I think it's 100%. I mean, I think we're so fortunate to be in Park City. We talk about this a lot with kind of the level of forward-thinking advisors and experts we have. And I know, Dr. Jen, you see it with Canyon Ranch. You have all of this team that's forward-thinking. But I was sharing the anecdote the other night where I've been to a couple of different girl weekend gatherings, and it's just interesting. The different geographies really kind of highlight the information flow that happens or doesn't happen based on what community you're in. We're all friends and have been friends in each of these different cohorts for 30 to 40 years, but we live in different areas. So the amount of information we're getting and the type of information we're getting, just like in all areas of life, but in this question specifically, it's different. So encouraging people to go out there and find that education, it's got to be a catalyst of being able to advocate for yourself. Take it so seriously.
Yeah, what I would say too is it's exciting that this black box warning has been finally taken off of estrogen replacement therapy, but that doesn't necessarily translate to all clinicians in the system have now been back trained. I mean, when I was trained on menopause, it was like antidepressants, black cohosh. There were very few options that we weren't, and then Premarin and Premprose. A
At
lot of
least you did
clinicians.
that, right? Like, so you did.
But a lot of clinicians, if this isn't an area of interest or this isn't your patient population that you typically see, and if this isn't something you've been really studying independently for the last 5-10 years, this hasn't been implemented in conventional training for the last 10 to 15 to 20 years. You got to find somebody who's been following it really closely.
Because I was thinking about this when Jen and I first started to talk about these issues. Menopause was like a word you didn't say at the dinner table. Like it was, like it just wasn't a word we talked about. So in the last 2 years, menopause has gone mainstream, hormone therapy has gone mainstream, protein's gone mainstream, creatine, fiber, like all these things are now so well discussed. Is there anything like that you're looking at right now that you'd say it's kind of nascent right now, but I'm betting in 2 years this is going to be a mainstream thing for midlife women, and they might want to learn a little bit more about it right now?
I kind of going back, I think it's data-driven science first and foremost. I mean, I think that's really the key. I mean, there's so many cool tools, right? I mean, and we can touch on them. There's peptide therapies that are, interesting for recovery and mitochondrial support. I think the peptide world is booming too. We're implementing a big program here at our clinic.
Yeah.
A lot of people do hyperbarics for cellular health and brain health and detox. We have a lot of people who come in to look at decreasing body burden so that they can age more effectively, right? So do I have chronic viruses? Do I have high heavy metals? Do I have lots of mycotoxins from mold toxicity in my system causing inflammation and brain fog and exacerbating how I feel? So I think we have the ability to dive deeper into testing to really direct us into the interventions that we want to do to optimize our terrain. Again, whether it's IV therapies, chelation, getting heavy metals out. We do a lot of ozone therapy to try to bring body burden down, decrease inflammation, increase mitochondria, ATP production. Again, I mentioned hyperbarics, different therapies that can support mitochondrial function like NAD and those kinds of things. But again, I think it comes back to learning your data so you know where to put your resources.
Yeah. I think Dr. Jen and I are both big advocates of it's lab you, N equals one. It's your lab. You need to know your data. So it's wonderful to hear you give people examples of what kind of data that means, they can go out and get.
And I think I love your point too, that you've said a couple times about trends, because I think we have to remember that, whenever, when we look at data, that's a singular snapshot, right? And so it's like we have to build the trends over time. And that's so important into how we track things, especially when we're talking about the longevity world, right? It's like you have to even expand that timeline a little bit. And so I, I think it's interesting. There's so much controversy. Let's just take, perimenopause and do you check hormone levels? And, I'm an advocate. I actually think it's helpful. I think it's helpful. You need to understand that it may not follow a regular pattern, but it's helpful to know if you're really high or really. At least for me, it was. And even in my own personal hormone journey, I could then feel like I knew when my estrogen went from normal to non-existent, and I wasn't having hot flashes. I just didn't feel good. And then I also knew because I was still occasionally having cycles, when it was way too high. And so like I could self dose my estrogen. I'm not advocating for that to the general public, but like it's really interesting. And then I had the lab data and trends to support that. And I was like, so I could really kind of tie my feelings to what my data was saying. And then you can spread out how often you need to actually get the data because you actually understand a little bit.
Well, and you can diffuse some of your stress about it, right? Because you know it's just that's all that's happening instead of spinning like what is happening.
And women
Well,
are pretty intuitive. Sometimes just understanding your data is very validating to how we feel, right? It doesn't necessarily mean there's something terribly wrong. I think it just validates what we're experiencing.
yeah. Well, I want to make sure that people know how to find your site because your site does have a wealth of information for people to get started on the journey. If they can't come find you here in Park City, which would be the best, if they can't do that, let's make sure they know how to find your website and dive into the expertise that's there.
Yeah, absolutely. I think we can post that in the show notes. I'm not going to make anybody's, it's Lindsay Wojciechowski, NP.com, which just rolls off your tongue. I know this one is 4 hours a day, but hopefully we can put it in the notes so people don't have to look that one up.
Awesome.
And yeah, I'm at a clinic here in Park City or over on Prospector for people who are local, and amazing clinic that with a ton of resources, all of the ones that I've mentioned on this show, a ton of testing options, and it's just a really, really neat spot to be able to help support people.
What's the name of the clinic so people can find it?
Be Vital.
Be Vital. Okay. Awesome.
Love it. Well, thank you for taking the time to share with us and talk with us. You're such an amazing resource to this community and hopefully with website and things even beyond this community. So thank you for taking the time. And I think there's a lot of noise in this space. And so we're always really excited to talk to people that help us cut through that in all different areas.
Thank you. It's been an honor to be on. Great to see you guys.
Great to have you, Lindsay.
Thank you.
Bye.
Thank you so much for spending your time with us here today. If you liked what you heard and you got some tips on how to live better right now and for the long haul, please help us reach more midlife women. Please share and rate and like this show, and we can't wait to continue the dialogue with you on our next episode. Until then, thank you. It's time.